Stretching exercise for frozen shoulder. Frozen shoulder progresses in three stages, which are the freezing phase, frozen phase, and thawing phase. When choosing intervention methods for frozen shoulder, it is important to evaluate the patient's symptoms and stage of the condition. This table shows the summarized key features and interventions of each stage. In this video, we will be focusing on stretching exercise. In stretching, it is important to begin with short duration range of motion exercise within 1 to 5 seconds. It also should be done in pain-free range within tolerable limit. Furthermore, before stretching, modalities such as a hot or ice pack can be used to relieve pain and improve muscle extensibility. Lastly, it is important not to irritate frozen shoulder, especially in early stage of the conditions, by avoiding aggressive stretching beyond the pain threshold, since it could lead to poor outcome.
What is the purpose of stretching? The purpose of stretching is to improve flexibility by lengthening muscles and tendons, increasing their elasticity and also range of motion. Stretching exercises promote muscle relaxation and relieve muscle tension caused by stress, sedentary lifestyles, and repetitive movements. Thus, stretching can improve posture by targeting the contributing tight muscles. Stretching will also improve muscle performance by increasing blood flow to the muscles, ensuring that enough oxygen is applied to them. And lastly, by increasing flexibility and range of motion, stretching will reduce the risk of muscle injuries such as muscle strains, joint sprains, and others in any form of physical activity. So how can stretching exercises improve frozen shoulder condition? As we know, frozen shoulder is characterized by stiffness, limited range of motion, and pain in the shoulder joint due to inflammations and adhesions. Stretching exercises are performed to target those tight muscles and the joint capsule. The stretching will gradually elongate the tight muscles, promoting muscle relaxation and reducing muscle tension. Regular stretching will stretch and lengthen the joint capsule surrounding the shoulder joint, reducing its stiffness and thus disrupting the adhesions in the process. Consistently performing the stretching exercises will gradually increase the range of motion in the shoulder joint, which further reduces muscle tension, leading to improved flexibility and the mobility of the shoulder joint. The stretching process will also gradually alleviate the stiffness, discomfort, and reducing the pain associated with the frozen shoulder, and thus enhancing the overall shoulder function.
Procedure of the intervention. Exercise 1. Passive forward flexion. Patient grasp the end of the rod with affected hand and the other end with non-affected hand. Use the non-affected hand to passively raise affected hand up until a stretch is felt. Hold this position for 10 seconds and return to starting position. 3 sets of 10 repetition and 2 to 3 times a day. Exercise 2. Passive abduction. Patient grasp the end of the rod with a non-affected hand and the other end with affected hand. Use non-affected hand to passively raise the affected hand to the side. Hold this position for 10 seconds and return to starting position. 3 sets of 10 repetition and 2 to 3 times a day. Exercise 3. Passive external rotation. Patient grasp the end of the rod with affected hand and the middle of the rod with non-affected hand. Use non-affected hand to passively rotate affected hand to the side while keeping the elbow in. Hold this position for 10 seconds and return to starting position. 3 sets of 10 repetition and 2 to 3 times a day. Exercise 4. Forward wall climbers. Patient stands facing the wall, 2 feet from the wall. Slowly walk fingers up to the wall as high as possible. Hold at the top for 10 seconds, then slowly lower 5 times and 2 to 3 times per week. Exercise 5. Side wall climbers. Patient stands with their affected shoulder 2 feet from the wall. Slowly walk fingers up the wall as high as possible. Hold at the top for 10 seconds, then slowly lower 5 times and 2 to 3 times per week.
There are several studies that mention the effectiveness of stretching exercise for the frozen shoulder patient. For the first article, a study by Chile and Mutlu in 2015 stated that Intervention carried out on patients with frozen shoulders shows improvement in their range of motion (ROM) after 1 year of follow-up sessions by doing joint mobilization exercise combined with stretching exercise. The constant score also shows improvement in the value from 39.1 until 80.5. Next, the article by Altikin et al. In 2016 stated that the intervention for treating frozen shoulder should combine the stretching exercise with other manual techniques for more effectiveness. The result shows significant improvement in ROM in both active and passive mobilizations to the clients along with other treatment. Lastly, another study by Leung and Cheng in 2008 stated that the improvement for frozen shoulder patients was shown when they carry out stretching exercise with hitting modalities compared to stretching alone. Patients' ROM in all groups improved after 4 weeks of follow-up sessions, but patients who only did stretching alone showed a decrease in their flexion range. For the overall conclusion, the stretching activity for frozen shoulder patients should be combined with other interventions for more effectiveness. These are the references that we use in this video. That's all from our group, and thank you for your attention.